Hi everyone, it's Derek here from AduMed. Now, one of the things you constantly hear about your exam is the importance of learning how to apply your knowledge in a practical way. So we explore a case based on lower urinary tract symptoms in men, and we take you through step by step. I've also attached a link to our theory video, which contains a breakdown of all the information you need to get through this case study. So don't forget to pause just before the end of each question, write your answer down and click continue when you're ready to move on. Let's dive straight in.
James is a 61-year-old male who is worried about prostate cancer following a recent diagnosis of this in a family friend. He recalls having a few intermittent episodes of urinary hesitancy, straining, and a poor stream. These episodes have been manageable and not had much effect on his ADLs. On examination, he has a non-palpable bladder and a smooth, benign feeling prostate. He has hypertension, for which he takes ramipril 2.5 mg, amlodipine 5 mg, and indapamide 2.5 mg. So, question 1. What is the most appropriate baseline assessment of his symptoms? Well, the key word here is assessment. We want to have a full understanding and appreciation of his symptoms. This is why the International Prostate Symptom Score is the answer here. It is a symptom validated score consisting of 7 questions scored in terms of symptom severity. PSA may eventually be arranged as part of a workup, but remember, this only points towards the possibility of prostate cancer if elevated. In order to have a baseline understanding of symptom severity, this will only be satisfied by the International Prostate Symptom Score. So, we have reviewed the patient and decided to arrange a few investigations. These show a normal PSA reading of 1.1 and a mild International Prostate Symptom Score of 6. The question here therefore is, what is the best way to manage this patient? Well, management here will be conservative. This includes advice around managing his fluid intake and also avoiding constipation. The reason why we manage conservatively here is that NICE suggests tamsulosin is to be offered in men only with moderate to severe voiding symptoms. His IPSS score falls within the mild category. His symptoms are manageable and not affecting his ADLs. In fact, he's come in today not worried about his lower urinary tract symptoms, but rather worried about the possibility of a diagnosis of prostate cancer due to what happened to his friend. Therefore, the approach here is to reassure and investigate and rule this out. Also note that the addition of tamsulosin here increases his risk of postural hypertension, as he's already on 3 other antihypertensives. Question 3. What additional symptoms will justify a suggestion of urethral milking as a management option in this case? While current NICE guidance suggests urethral milking as a management option in patients who experience post-micturition dribbling. Question 4. If the patient develops storage symptoms such as nocturia and urge incontinence, in addition to his voiding symptoms, what medication can you consider adding to tamsulosin? Well, current NICE guidance suggests adding in an anticholinergic such as oxybutynin to an alpha blocker if a man has a mixed picture with both storage and voiding symptoms that persist despite the use of an alpha blocker. So, thanks for joining us today. Please share this with your colleagues if you found it helpful. Don't forget to like and subscribe, as this will really help the channel to grow.